Call this meeting of the Parkview Health Center Committee to order. First item is approval of the January 19th and February 16th, 2023 meeting minutes.
Make a motion to approve the January 19th minutes, or the January 16th minutes. I think, yeah, I got it.
The ninth.
They're in today's packet, the one that was handed out today.
I have the 19th in my mail copy as well. January 19th was.
I'll second it if no one else wants to.
Motion, and a second to approve the January 19th and February 16th minutes. Any additions and corrections?
On February 16th, item 7, line 5, where it said there were 4 resignations, 1 was a retirement, 1 individual was promoted, and 2, and it stops there. So,
It should say and 2 resignations.
okay, and 2 resignations?
Yeah, 2 staff items.
Okay,
2 staff items.
All right, we'll just get that corrected. Anything else?
That's all you know.
All right, then we'll vote on the motion. All in favor, say aye.
aye.
All opposed, say nay. Carries 5-0. Item 3 of public forum. We don't have anybody.
We have 2 people on with that, Winnebago citizen and Steve Bender.
If anybody on Zoom would like to address the committee, go ahead and open up your mic.
I have a question.
Oh, yeah.
Public. Will we be allowed today to discuss the staffing shortage and how to deal with that issue? Is that on the agenda or?
So I think we have a couple of points where we can ask questions about that.
Then I'll just wait.
Okay, if you have I think if you have something to say, you know, that's sort of a more of a statement or something.
Okay, yeah, it's a statement.
Go ahead.
I was just thinking about the shortage and what we could do, and before the meeting, I was talking with the director and if there's not enough domestic workforce to handle staffing, we could go abroad to look for workers, and she mentioned that we are doing that, you know, potentially there's a company that they're working with. Am I correct?
Mm-hmm.
And that the Philippines is one resource of nursing employees potentially that could be tapped into for help, and they should be able to get visas if there's a shortage of workers in the U.S. I think normally you're allowed to bring in foreign workforce, so that was one idea that already you're aware of. And then I thought maybe we could offer a housing incentive for all employees that would desire it, either within this existing facility in the shutdown areas, or we could buy or master lease an apartment building nearby to offer a housing incentive, which may be something that's not typical in the market and might be a attractive, you know, an attractant for more workers. That's basically what I wanted to talk about.
Thank you very much. I think we've got a couple of ideas that the committee has heard like that, you know, heard it in that way, and then we've been able to get them on the agenda item, and you know, perhaps with some research or some other ideas or thoughts from the rest of the administration. So I think let's come back to those.
Sure.
As we. Anybody on Zoom, trying to unmute, or does it look like anybody there is trying to speak to us? Okay, all right, we'll close that portion and go to item 4, the financial report.
All right, so I have the February financial statement in front of you. The percentage of usage should be around 17%. And if we're looking at revenues, total revenues is about 15.46, so we're doing fairly well compared to budget was for 143 residents. So, and we're currently at 99. So even with the lower census, we're still doing fairly well on the revenue side. Labor is running at 12%, so we're under what we're projected to be using at this point. Travel is minimal. Capital outlay, we haven't completed any items yet. We're in the process of getting a few of the items in. I know our new scrubber is on order that we carried over from last year. And will be the dishwasher is in the stages of being put together. So that probably by the end of May we'll see jump up in the capital area. The other areas are running fairly consistent. Repairs and maintenance are a little bit higher than 17, but there was one big item in there for equipment repairs that caused it to be a little bit higher than 17%. And then notice that we didn't have a heat bill hit the account yet, which is, I know I just saw some come through just recently, so really should hit really soon. And then our contractual services, which is our nursing and staffing services are sitting there at 89,000. So we're running lower than 17% of the budget. Everything else is consistent. So right now we're sitting at a surplus of 285,000, which at this point of time we would have budgeted about 382,000 loss, and so we're about $668,000 better than what we had originally budgeted. So really well.
Any questions on the financial report? Okay. Hearing none, we will move on to the administrator's report.
Okay. Our last COVID outbreak ended March 3rd with residents anyways. We did have just a recent one staff member positive, which again does put us in COVID outbreak status. If you have one resident or one staff member, you're considered in COVID outbreak, but no residents. We closed the COVID unit on March 3rd, moved everybody back to their neighborhoods, so we're good to go with that. Average census for February was 98. Admissions, we had 2 admissions, 1 discharge. We're very limited right now on beds due to staffing, so we're taking in when we can and coming up with ideas of moving residents to other neighborhoods so we can open up some more rehab beds. We have 26 current people that are on the wait list right now. Payer sources, we had 24 private pay, 63 medical assistants, 6 family care, 0 insurance, 4 Medicare Advantage, 2 Medicare, with a total of 99 for census. We're currently at 99 right now as well. Staffing update, we have for the training center, we had another class that started yesterday with 6 students in there, so that's very exciting. And we have classes that are going to be, we're going to have another class right after this one is done, and another one in May. So it looks like those classes are going to be booked with 8 students in each class. So that's wonderful. We'll get a lot of CNAs on the floor working. It's not necessarily a staffing update, but just an update as well too. We did get our paid feeding assistant program approved by the state of Wisconsin. So we do have that class is starting next week. And we've got 8 hospitality aides that are going to be going through that program. So then they can also help feed or assist residents in eating on the floor. So for example, one neighborhood, we have 21 residents that need assistance eating. You can imagine that's probably pretty difficult for 4 people to help assist 21 people. So this is going to be a huge advantage to us, being able to have the paid feeding assistant program. Survey updates, we had our annual survey. They came in February 15th. We had 3 health citations with that survey, no harm takes, so that's always good. No fees or fines that we have to pay, it's even better. So we did get our statement of deficiency, and we did put in for a plan of correction. We're just waiting to get that back to the state, from the state, to let us know that they have received our plan of correction and they find us within substantial compliancy. So just waiting for that letter. Some projects that we've got going on right now, the water heaters. Well, Mike's gonna talk a little bit about that in a second, but the bid came in. We have that on the agenda to vote because it did come in as additional costs than what we had budgeted for. We do have the dishwasher that has been ordered. Looking at shipments expected mid-May, so just working on that along with facilities with the exhaust system that needs to be put in along with that. And then we also have the AV projection project for the great room for the residents. So if you remember, this was in our budget for 2023. We have a closed circuit channel within the center. So they can basically video bingo that's in the great room out to the resident rooms. Currently, the system right now is not compatible with the smart TVs that are in the rooms. So some residents get bingo in their room and some residents don't get bingo. So this would help, so everybody had access to that closed circuit. So we did have one quote that came in, and we're just working on getting a secondary quote.
And just to add on to that, the quote that came in was over the $20,000 limit that we could go out just with without an RFP. I talked to Laura, and there is a state contract with a company. And if we have them come in and give us a quote, and if their quote is lower than the one we currently have, we can use that. Or if theirs is higher and we have the secondary quote of this other group, we could still go with that using the state contract as our RFP pretty much. So we don't have to physically go out for an RFP. if we get them to come in and work for us.
Lose back up a little bit too, because I missed my staffing numbers. So for the month of February, a current number of staff members that we have at Parkview is 170. We hired 5 staff members in the month of February. There's gonna be a lot more in March, just things are looking really good. Retention percentage is, she's got, I don't think that's right. 95%. Turnover percentage is 5%. We had 8 resignations. Some of those were changes in positions. We had three people that changed per point status and or were promoted from an LPN to an RN. Those all count in that. We also had a retirement of an RN shift supervisor, retirement of an accounting associate, and Brian also retired too, didn't he?
No, he moved on to-
We had a resignation of our environmental service manager or housekeeping manager. One termination, current open positions, we have 13 RN or LPN positions, 52 CNA positions, 11 hospitality aides, 4 housekeeping, and 2.5 food service positions that are open.
So I have a question about that. So if a person goes from point A to point 6, so that counts as a resignation.
Mhm.
They go from point 6 to point 8, does that count as a hire?
No, because they're changing status. Anytime they change a status, it counts as changing, but I don't think PEG counts that as number of staff hired.
Okay.
But I can ask her to be, I can get a clarification from her though.
I think from, and I don't know if this report is used for something other than, servicing this committee, but I think it would be helpful. You sort of knowing that with 170 employees and the nature of healthcare, that like switching. Point status is correct me if I'm wrong, but like a fairly common thing. Not just within our facility, but within the industry, that it would be more helpful to sort of know like the people whose relationship is being severed, especially if it's only sort of counting on the negative side, right? Because if you had that person who went from point 8 to or the other way, I guess, increase their amount, you're not getting those as a credited as a hire. I don't think we're really seeing like apples to apples on this.
Sure.
But it is helpful to know, or at least if we can't do that, to at least have those delineations in the notes section about how many status changes there may be. Any other questions or comments about the administrator's report? Okay. Then we'll go on to item 6, a discussion and vote budget transfer for hot water.
Mhm.
Transfer use some additional signatures.
Okay, let's let staff present first, and then we can discuss and figure out the signatures and whatnot.
Yeah, if you go through those. So, we originally had budgeted last year, 87,924. We had Context do the design work, and they were, had a PO issued for $10,000. We did a budget carryover for 77,000, type 2 carryover. And so the bid that came in was 98,000. And so we're short about 20,638, and they recommended a contingency on there of 9,856. So we're looking at a budget transfer of 30,500.
questions
Yeah.
for Mike?
Sure.
You've always got my answers for me, so. So we spent 10,000 to contact,
Mhm.
but are we replacing three?
Yes.
Years, because one I thought you said was.
One is dead, one
Okay.
is on the verge, and one is okay right now.
So-
But they're all, well, two of them are the same vintage, one we replaced already. And that's the one that's good, but they're all the same models. So we're not getting the lifespan out of them that we had hoped.
So, and this is just me asking you this.
Sure.
What did we get for 10,000 from Context that we needed to have?
We needed the specs and the drawings,
So we had to have specifications.
Yeah.
Okay,
because anything over $26,000, we have to go out for a sealed bid.
okay,
So we have to have the specs.
okay.
And this work was more than what our plumber could do, so we couldn't do it in-house. And in the meantime, we've lost our plumber due to retirement, and we haven't been able to fill that. So we're having to contract out all of our plumbing work now for the county. But what's interesting with this is we initially got a quote from Tweed Garrett, which was $1 amount, which led us to the point that we had to go out for specs. The engineers came up with a $1 amount, and I thought the engineers came up with the $87,000, and that's what we asked for. So that was more than what Tweed Garrett gave us. We broadcast out this bid to 121 firms. 11 firms pulled the bids. 4 firms came here to take a look at the job, and only 1 firm submitted a bid. So, and that's what we're seeing throughout all of ours. I've got a project right now that's gonna be coming before you guys at the county board, the Oshkosh Human Services elevators. That one, we put out over 200 people got it. All of the major elevator companies got it, and only 1 firm came back. I don't know what's going on out there, other than everybody has got the same problems that Parkview, I have, that they don't have the staffs. In fact, the contractor for the elevators has basically said, this is the last bid we're going to do this year, because we are booked out for the entire year. So, I think we're going to be seeing this kind of stuff for the near future, when we go out for bids, in that, the economy is really squeezing us, until maybe that there's a contraction in the economy, that people aren't getting the work. But from what I can see right now, everybody is filled up on their calendars, and we're, not just us, but everybody who's getting jobs are going to be paying premiums. So it's just hard to predict. And then a lot of the materials that we get are tied up in the supply chain. And I told my committee, I'm tired of telling you guys I'm having supply chain issues, but I'm still waiting for parts for 2 years to finish a couple of the projects we were doing in-house. And we just can't get them. They come from China, and we all know how the world is going right now. So a lot of these types of things that we want to get, they aren't made in the United States. They're made in foreign countries, so they have to come here from someplace else. So to answer your question, what did we get for the project for $10,000? We got the specs, we got the professionals to do what we needed to do to go out for bids. We thought we had done due diligence with getting a quote from the engineers, and actually getting a quote from Tweed Garrett. And I don't know if I mentioned, it was interesting, Tweed Garrett didn't pull out the bids. So, I think we did as best we could to try and come up to you with a real price, but it's not what we thought it would be.
Have you had any contact with this bidder as to lead time? not
I have
yet?
not personally, but I think, as far as I know, from what we talked to our vendor, because they bought the the water heaters would be coming from the same vendors we do for our own work. They're already on order, but we haven't awarded the contract yet.
Okay,
So, Herkman is taking a risk, because if we don't get the funds from you guys, then we have to go back and say, we can't award the bid, and then they've got 3 water heaters on order that they're going to incur some cost to.
yeah, not cool. And you can't run the ship here with one down, one going and one,
No,
I mean,
no,
that's.
we can do it with the 2 that we've got,
Yeah,
but the one is leaking, and when we do the annual inspections for they call them pressure vessels, it could be a potential that, the inspector would say, you know, this is really leaking more, but we haven't seen a greater, you know, we have not seen any indication that it's gotten worse, but it's not one that we can just
right.
neglect. And one water heater will not help, will not do it.
No. Okay, thank you.
Any other questions? Take a motion to approve the budget transfer.
I'm wondering if, do we need a budget transfer at this time if we haven't got the,
I need the budget transfer in order to award the contract.
we're gonna need, have you had this presented to your committee?
No, because it's coming out of funding from Parkview.
I'm saying, have you voted to go ahead with it?
No, it has not gone before my committee. And I was not planning on taking it before my committee, because they've already approved the project. The money's coming from Parkview, so Parkview and the P&F committee and the county board has to approve it. It's not really something that the facilities committee said replace the water heaters.
Motion to approve.
Second,
Second, any other questions, comments, or concerns? Okay, all in favor, say aye.
aye.
All opposed, say nay. The motion carries. On to item 7, suggested topics. Supervisor Swan, the items you brought up earlier, are those ones that you would like to see brought back as agenda items where we can have the staff report kind of on what they're doing on those items and then open up for a broader discussion?
Yes, that'd be good.
Okay. Thank you. Any other items for future agendas? Right. Then our next meeting would be scheduled for April 20th, 2023. We return to that. That brings us to item 9, adjournment.
So move.
Second.
Right, all in favor, say aye.
Aye.
We are adjourned. You all.